Some don't think they need the vaccine, but they still do. No data to support that claim, Mike, whatsoever. Some have also developed COVID in the interim after the first dose. So they've had to delay getting their second, which could be affecting numbers. I particularly like that one. So you get vaccinated, which is going to protect you, but it doesn't. Well, you need 2 doses. And then is there evidence that it protects you fully? No, there isn't. So the spin continues. There's no doubt we're struggling to get higher uptake in lower age groups than we'd like. Who is we? I wondered when I read this statement, because does he regard himself as simply being part of the British government team? Is he part of the SAGE team? Is he part of Boris Johnson's cabinet team? Who is the we? Well, of course, we're not told. It's a bit of inertia as well as natural infection affecting the numbers, but we'd expect that to improve in the coming weeks if cases continue to fall. So cases are falling. The COVID is not dangerous for younger people, but despite that, we've got to keep pushing for vaccinations. Now is also a really good time to be able to get both doses before starting university in September. You don't want to be self-isolating when you get there. Now, I'm going to comment on this because what Rachib Ali is doing is ending with the applied psychology of fear and a threat. I.e., if you don't do what we suggest you're going to do, if you don't do what we're telling you, then you could be in a very nasty position, self-isolating at university. And of course, we know there's a huge increase in mental health problems amongst young students as a result of the government's lockdown policies to date. So a Sky News article with no data, document, statistics, or evidence of any kind to back up the claim in the headline.
Well, the Telegraph day or two ago claiming an exclusive that over half of COVID hospitalizations tested positive after admission. And what they're saying is leaked data suggests vast numbers classed as being hospitalized by the virus when they were admitted, when in fact they were admitted with other ailments. More than half the COVID hospitalizations are patients who only tested positive after admission, according to leaked data. The figures suggest vast numbers are being classed as hospitalized by COVID when they're admitted with other ailments, with the virus picked up by routine testing. So in other words, they're exhibiting no symptoms. They went in for another issue. They were then tested and they tested positive. Experts said it meant the national statistics published daily on the government website and frequently referred to by ministers may far overstate the levels of pressures on the NHS. The leaked data covering all NHS trusts in England show that as of last Thursday, just 44% of the patients classed, 44% involved people who tested positive in the 14 days before hospital entry. A further 43% were made within 2 days of admission, with 13% made in the days and weeks that followed, including those likely to have caught the virus in hospital. So they do quote Carl Hennigan from the Centre for Evidence-Based Medicine at Oxford University, and he said that data is incredibly important and it should be published on an ongoing basis. When people hear about hospitalizations with COVID, they will assume that COVID is the likely cause, but this data shows something quite different. This is about COVID being detected after tests were looking for it. And they also quote Graham Brady, who's the chairman of the 1922 committee, saying that nearly 18 months into the COVID crisis, it's absurd that data is breaking down hospital admissions still isn't publicly available on a regular basis. Counting all patients who test positive as COVID hospitalizations is inevitably misleading and gives a false picture of the continuing health impact of the virus. Greg Clark, who's chairman of the Common Science and Technology Select Committee, chimed in as well. He said if hospitalizations from COVID are a key determinant of how concerned we should be and how quickly restrictions should be lifted, it's important that data is not presented in a way that could lead to the wrong conclusions being drawn. While some of these people may be being admitted due to COVID, we currently do not know how many. And for those who are not, there's a big distinction between people who are admitted because of COVID and those who are in for something else, but have COVID in a much more mild form, or it's not the cause of their hospitalization. And I'm going to say, well, I'm glad some people are starting to catch up on this, because this is a point that we've been trying to make for about a year now, I think. So what is this article? Is this an attempt to sort of walk back from the previous position in the mainstream press? Or is this finally an admission by the mainstream press that they've been wrong from the beginning on this?
I think it's the truth, Mike, starting to spread through the system. They've pumped out all of the misleading information, and the mainstream media, I'm talking about the press, have pushed out all the government policy. A lot of that has been untrue. It's been misleading. It's been propaganda. Now what we've got is truth, which is very powerful, starting to seep back through the system. So this is to anybody who's speaking out and they're looking at in the right direction and presenting the right data needs to be supported.
So let's have a look at this then, because maybe it gives some more indication of misleading information we've had over the last 12 or 14 months. This actually was published in December. It's a paper from Italy. It's entitled "Unexpected Detection of SARS-CoV-2 Antibodies in the pre-pandemic period in Italy." And so this was from Italy's Istituto Nazionale dei Tumori. It's a cancer institute, and they collected blood samples with respect to cancer patients in September and October 2019, which seemed to indicate that coronavirus antibodies were already present at that point. They were these cancer study samples were retrospectively tested. And the results showed that 11.6% of 959 healthy volunteers had antibodies in their blood already in September, October, which means they had to have been infected prior to that. And so the suggestion is that these were people that were all male smokers, that were all 55 to 65 years old. And it's not clear why they should have had these antibodies, as you can see from the title of this. But we'll just say that, of course, we've had other scientific research. Oh, sorry, just before we get to that, we'll mention this article, "COVID-19 Italian Study Revives Debate Over When Pandemic Started in Europe." This is from the local.it. This, because up to date, this December research has now been confirmed by the World Health Organization. The quote in this article is that the results of this retesting suggest that what we previously reported, that asymptomatic patients is a plausible signal of early circulation of the virus in Italy. Well, they keep banging on this asymptomatic narrative. That's not quite accurate, but anyway, because they've no clear knowledge of whether these people were symptomatic because they weren't looking for symptoms of this at the time. If this is confirmed, this would explain the explosion of cases observed in Italy. SARS-CoV-2 or an earlier version circulated silently beneath the surface. Well, could that be because the vast majority of symptoms that people see are similar, if not identical, to the symptoms of other respiratory viruses? So it was only once there was a claim of a novel virus that we started heading into what was being described as a pandemic. So this thing clearly seemed to be doing the rounds prior to that, and we have evidence from other countries as well. Of course, let's just remind ourselves that Barcelona had been testing wastewater. This is something the British government is doing now, finding the virus in sewage water. But this was from March 2019. They claimed to find it. Now, this particular report was subsequently rubbished by the various fact checkers, but it's not clear exactly whether the fact checkers were even close to being right. In fact, we can say that they weren't. But anyway, another case here from Brazil, coronavirus in sewage sample in November 2019. So there's lots more and more scientific evidence being developed that antibodies and also viral material in sewage doing the rounds in 2019, long before this thing was claimed to have become a novel virus.
Yeah. And I'll just make the point again that everywhere that there's been flooding, whether it's in UK or Europe overseas, inevitably in the flood water is a large proportion of sewage, and nobody in officialdom is commenting, of course, on the risks of sewage contamination in those flood waters, with the risk of COVID in the background, and certainly South West Water doesn't want to talk about that. Well, let's change the angle a little bit and come in with our old friend Susan Michie. Now, this is a report from the Daily Mail a little while ago, back in June, and the headline was "Social distancing and face masks should stay forever," says Communist SAGE committee member Professor Susan Michie. Now, she was taken to task on one of the mainstream media interviews over the fact she was a communist. She got very shirty about that and said it was irrelevant to the fact she was a scientist presenting scientific information. But the key bit of this was that she clearly felt that the restrictions that people were facing at the moment was something that was just going to last into the foreseeable future. And that comment was enough to make a young lady, I think it was a Sky journalist, nearly fall off her chair while she was doing the interview. So we've been having a look at what's been going on, not only with SAGE, but with the SPI B committee. And one of our sharp-eyed viewers came across this document from Implementation Science. And we're straight into the realms of applied behavioral psychology, behavioral influencing behavior in order to get political policies in place. And this has come up with a wheel. Now, I'm sure many people have seen these little cardboard wheels that you have for various things. Maybe it's how you cook an egg properly, or how you organize your day, but you've got a series of discs which can be spun and positioned against each other in order to produce certain results. But this is the level of research that we're now seeing is being used to influence the population of UK in order to get us to adhere to government policies. And of course, the main target area is that we should adhere to all of the policies with regard to face mask, lockdown, restrictions into venues, and of course, vaccines. So why are we interested in this? Well, this is part of the document itself, the Behaviour Change Wheel, a new method for characterising and designing behaviour change interventions. And our viewer spotted that Susan Michie was the lead name amongst the authors. And we just found it very interesting that we've got this lady as a communist now working to help the government change the behaviour of the population so that we adhere to their policies without necessarily questioning. So if we just look at a bit of detail, the background of what was going on here was the design and implementation of evidence-based practice, and that depended on successful behaviour change interventions. This required an appropriate method for characterising interventions and linking them to, quote, analysis of the targeted behaviour. There exists a plethora of frameworks of behaviour change interventions, but it's not clear how well they serve this purpose. So they're gloating here, Mike, at the armoury they've got in order to use applied psychology, but they're not very clear apparently about how it works. So let's have a look. Methods: a systematic search of electronic databases and consultation with behaviour change expert was used to identify frameworks of behaviour change interventions. I wonder what electronic databases she's referring to there. Could this be to do with the NHS or social services? We don't know. These were valued according to three criteria: comprehensiveness, coherence, and a clear link to overarching model of behaviour. The reliability with which it could be applied was examined in two domains of behaviour change: tobacco control and obesity. Now, I'm going to say to our audience, don't be fooled by the fact that tobacco and obesity are mentioned here, because as we dig into this material, we are seeing more and more that there's always a soft line. Don't worry, we're only looking at tobacco and obesity, when in fact we can see deeper and deeper and deeper levels that they're targeting with behavioural change. So we'll follow through. These are the results. 19 frameworks were identified covering 9 intervention functions and 7 policy categories that could enable these interventions. None of the frameworks reviewed covered the full range of intervention functions or policies. Only a minority met the criteria of coherence or linkage to a model of behaviour. At the centre of a proposed new framework is a behaviour system involving 3 essential conditions: capability opportunity, and motivation. This forms the hub of the behavior change wheel. So all of these scientists work